LSD, or lysergic acid diethylamide, was first developed in Switzerland by Albert Hofmann and is derived from ergot alkaloids. Ergot is a fungal disease that occurs most commonly in rye. Hofmann believed that the drug would be useful in treating patients with breathing and circulatory issues. However, the drug had no obvious effects during the preliminary tests on mice, so Hofmann abandoned the project to pursue other ventures. Several years later, he readopted the project, and while synthesizing a batch of the drug, he accidentally dosed himself with LSD. On his way home, he began experiencing strange sensations that are today known to be effects of LSD. Essentially, Hofmann was the first person to have a psychedelic trip. Hofmann believed the drug to be promising in the field of psychiatry, so Hofmann's laboratory began producing large quantities of the drug and distributing it to psychiatric institutions for general experimentation. Hofmann even encouraged psychiatrists to take the drug themselves to help understand what their schizophrenic patients were experiencing. Doctors were impressed with what they were accomplishing with the drug, and by the time 1960 rolled around, hundreds of articles had been published in medical journals and magazines about LSD. Because of the excessive recreational use of the drug by the 1960s hippie culture, the U.S. ended up classifying LSD as a Schedule I narcotic. This means that the government thought that the likelihood for abuse far outweighed the possible medical uses. Tests using LSD for medical purposes became far less frequent, and by the 1980s had been altogether abandoned. LSD is classified as a hallucinogen because people under its effects are said to hallucinate. In actuality, people don't necessarily hallucinate. LSD just alters the way that people see the world around them. For somebody to hallucinate, they need to see something that isn't actually there. People on LSD just see what's there in a different way. Many people report having intense spiritual experiences while on LSD and emerge from their trip believing that they have a better understanding of life and how the world works. So on to how LSD actually affects the brain. The molecular formula for LSD, C20H25N30, isn't particularly complex, and scientists still aren't sure how exactly LSD works. There have never been any studies on just what exactly LSD does to the human brain to cause such intense experiences of altered reality. The best explanation scientists have been able to come up with is that LSD messes with the neurotransmitter serotonin. Serotonin is derived from the amino acid tryptophan. The concentration of serotonin in your brain affects your mood, sensory perception, muscle control, as well as other things, all of which LSD is known to affect. It is believed that LSD limits the amount of serotonin in the brain, which in turn causes LSD's drastic effects. Okay, so let's talk about dosage. When Albert Hofmann first accidentally experienced the effects of LSD, he decided he would purposefully dose himself. He decided that the threshold dose, or the minimum dose required to feel the effects of the drug, was around 250 micrograms. In reality, the threshold dose is around 0.25 micrograms for every 2 pounds of body weight, the average dose being around 25 micrograms, so Hofmann's dose was 10 times as powerful as it actually needed to be. Hofmann described his experience in his biography. He believed he was dying and demanded that a doctor be called. After he was sobered up, Hofmann continued to experiment with dosage with other members of his lab until the threshold was found. Recreational users mainly use LSD through blotter paper, an extremely absorbent paper that is used to hold 1 dose of the drug. During the peak of its recreational use, the average dose was 100 micrograms, 4 times the threshold dose. However, this still doesn't come close to Hofmann's first experimental dose of 250 micrograms. Because of LSD's classification as a Schedule I narcotic, there haven't been many recent scientific developments with LSD in America. However, scientists in the US have begun testing psilocybin, a powerful hallucinogen that's found in several different types of mushrooms. The tests are performed on terminal cancer patients as well as alcoholics and drug addicts. These types of tests were being done when LSD first came out, but were discontinued when the drug was banned. The belief is that the trip induced by the hallucinogen, along with some psychiatric help, can conquer addiction. In Switzerland, the same study is being conducted, except with actual LSD. Early results are promising. Terminal patients show less anxiety and improved mood, and alcoholics and cigarette smokers find it easier to quit smoking or drinking. There are also studies that involve hallucinogens and obsessive-compulsive behavior and post-traumatic stress. These studies are indicating that hallucinogens are helping people overcome these disorders. Keep in mind, all of these studies are in their preliminary phases, but they are all currently showing promising results. I think that LSD could have a very important role in the future if we allow it to.
If future testing with hallucinogenic drugs points towards helping people with serious psychological problems, then hopefully the regulations on LSD will be loosened enough to allow medical testing in the US. I think that if scientists can figure out exactly how LSD affects the brain, they'll learn a substantial amount about how the brain works. LSD has enormous potential for helping people with a large variety of problems. I think that scientists have only scratched the surface when it comes to psychiatric uses of LSD, and if more projects can be funded in the US and other countries, we might be closer to helping many people with their psychological problems. I hope you all enjoyed the presentation. I'm going to open up the floor for questions.